Yeah, we are live. So, hi everyone. We Today I welcome you to the session on menopause, its challenges and how to maintain healthy lifestyle by Apollo Credle. To speak on this topic today, I would like to welcome Dr. Aisha Khalik from Jubilee Hills. She is our in-house consultant, obs and gynecologist, and she has done her MBBS, FMAS, and DMAS. We welcome you, doctor. You can take over the session now.
Yeah, thank you. Hello, everyone. I am Dr. Aisha Khalik. I'm consultant obstetrician, gynecologist, and laparoscopic surgeon practicing here at Apollo Cradle. Hi, everyone. And today I'm going to talk about a very important topic, which is menopause. As you all know, menopause is an important transition in women's life, and it's a thing which has a lot of challenges. And there is a transition period during which women have lot of symptoms and mood changes, which are very distressing. So I'm going to start this topic. So first and foremost thing, we have to understand what is menopause. As you have, the meaning of menopause is already in its word, menopause. That means stoppage of menses. If you are in age group of 40 to 50 years, 58 years of age, and if your periods have stopped coming for more than 12 months, that is 1 year, it is called as menopause. So generally, why this menopause occurs? Menopause is a phenomenon which actually starts at the time of birth. Already at the time of birth, our ovaries, they have a number of ovum. Already it is determined in the ovary at the time of birth, and how many ovaries are there? Around 1 lakh follicles or ovum will be there in the ovary at the time of birth, and after birth, as the uh, growth occurs, and every menses occur, this ovum will be utilized. And when there is no more ovum, or the ovarian follicle is left in the ovary, it will stop functioning after a certain age. And this stoppage of functioning of this ovary will lead to menopause. So generally, if we see in foreign countries, the age of menopause is around 50 years, but our Indian women, the general age of menopause is around 46 years. So in some ladies, it is also seen that before 40 years of age, also nowadays, in around 1% of ladies, there is cessation of menses, stoppage of menses, and it is called as premature menopause. So before this menopause occurs, is in how a lady will know that she is going to land up in menopause. So before this menopause, there is a period of around 3 to 4 years, which is called as perimenopausal period or perimenopausal transition. So during this time, many ladies, they experience mood changes, hot flushes, and their cycles, they because of lack of ovarian reserve, that is ovarian follicles, their cycles may become short, or they may have prolonged cycles. So the duration of the cycles also change. So these are some of the symptoms which they can observe in the perimenopausal period. Some ladies, we also observe that because we have to remove ovaries because of some pathological condition which they have in ovaries, like endometriosis or ovarian cancer or some ovarian torsion or ovarian cyst. So they may have to undergo surgery in which both their ovaries have to be removed. So because of this bilateral removal of ovaries, they may land up into what is called as artificial menopause. So, what is the most important thing about menopause? Why we have to know about this menopause? So, the most common symptoms which are noticed during menopause are vasomota symptoms. That is hot flushes and mood changes. These are seen in around 70 to 80% of ladies. So, why these hot flushes and vasomota symptoms occur? That is, most of the ladies, they come with complaint, doctor. In spite of it being so cold, I'm having sweats. I'm feeling so hot, I'm having chills at night. So they usually come with these symptoms to us. And these generally are more during the starting 1 to 2 years of menopause. Uh, but they may, in some ladies, last for a little longer period also. So why these occur? This is because there are certain hormones which are released from ovary, like estrogen hormone and progesterone hormone. So estrogen hormone, it suddenly stops coming out from the ovary. So because of lack of this estrogen hormone, ladies, they develop these hot flushes and mood changes and all these symptoms. Uh, so, what are the simple steps which you can take to prevent this or decrease these hot flushes? So, you should see that you stay in a cool environment. If you are obese, then there are more chances that you will get hot flushes. So, you need to do work on your weight loss. If you have habit of smoking, then you should stop smoking, because smoking increases the chances of getting hot flushes. If you take alcohol, you should limit your alcohol, and you should do daily exercises. You can do yoga, meditation to decrease these hot flushes, and even acupuncture therapy also helps in these hot flushes. And it is better to avoid spicy foods. So, what in diet will help reducing these hot flushes? If you take whole grains, green leafy vegetables, lot of fruits, nuts, cold press oil, all these healthy food habits, if you develop, then there are less chances of you getting hot flushes. So, suppose if your hot flushes are very distressing and they are affecting your daily life, then you may have to consult your gynecologist. She may prescribe you HRT, what is called as hormone replacement therapy. So, they give you estrogen hormones, because of which your symptoms decrease. There are also other medications which are not hormones. There are many other medicines also available which are not hormonal medicines to treat these hot flushes. So, according to your symptoms, the doctor will prescribe you treatment. The next most important organ system which is affected in menopause is genitourinary organ system, that is your bladder and your vagina. So because of lack of this estrogen hormone, your bladder and vagina, they become weak. The muscles and the structures, they become weak in that area. So what symptoms you can have because of this? They will be always vaginal. You'll have irritation in your private parts. They will be itching in your private parts. There will be dryness in your private parts. Then you may have frequency of urine. You may have pain while passing urine. Then sometimes your urine may leak when you cough or you get up. So there may be leakage, which is called as urinary incontinence. And they can be recurrent urinary tract infections, UTI, which we call. So you may suffer with these. And because of vaginal dryness, because there is vaginal dryness and vaginal lubrication is less, then they may be you may experience pain while sexual intercourse. So all these are the symptoms which you might face at the time of menopause. So it affects around 50% of ladies during menopause. So what are the things by which you can decrease these symptoms? So if you have all these symptoms, you have to consult your gynecologist. She will suggest you, there are many medicines, vaginal lubrications in the form of creams, jellies. So you can use that to decrease all the symptoms. Then pelvic physiotherapy has a lot of role in decreasing these symptoms, like Kegel exercises. You can consult a physiotherapist and you can start exercises of your vaginal area, which will increase the muscle strength and help you in decreasing these symptoms. And suppose if your symptoms are not relieved by all these things, then your gynecologist may also prescribe you estrogen creams or tablets or estrogen rings to be kept vaginally. And with this, your symptoms can be relieved. And some ladies, they also experience sexual dysfunction, and around 10 to 15% of ladies, it is seen that they are not interested. They have loss of sexual interest because of the fact that there suddenly so many changes occur in your body. They will be in a depressed state. There will be a lot of anxiety. There will be a lot of stress and a lot of fatigue. So even this symptom can be noted. Another most important thing or change which will occur in your body at the time of menopause is in your bones. So it is osteoporosis, which is seen in around 70 to 80% of the ladies. So because of lack of this estrogen hormone, again, there are chances that your bone may become weak. So there will be decreased calcium deposition in your bone. So what will happen if there is less calcium in your bone? There are more chances that you may get fractures. So ideally, for all ladies who are more than 65 years of age, there is a test called bone mineral density test, which has to be done at regular basis to see whether the lady is landing into osteoporosis or not. Because if she is having osteoporosis, there is increased chance of her having fractures, vertebral fractures, leg fractures. So, what all preventive measures can we take to lessen this osteoporosis? So, you should, in your diet, increase supplementation of calcium. You should take diet which is rich in calcium, like dairy items and nuts, calcium, and vitamin D. Uh, and daily during menopause, there is a requirement of 1200 milligram of calcium and 800 to 1000 international units of vitamin D. So you should get your vitamin D checked up, and if it is less, then the doctor may even prescribe you calcium and vitamin D medications. Then regular weight bearing exercises have to be done. There are a lot of regular weight bearing exercises and muscle strengthening exercises around 30 minutes daily. They help a lot in decreasing osteoporosis. If you take alcohol, then you have to limit your use of alcohol, and you should stop smoking. Uh, Another important system, another important organ in your body which also gets affected during menopause is your heart. So estrogen hormone, which is released estrogen hormone which is released from the ovaries, they have lot of cardioprotective effect on women. So ladies, menopausal ladies are at increased risk of getting cardiovascular events and heart attacks. So ladies who are having diabetes, hypertension, and dyslipidemia, they are more prone for having this cardiovascular events. So what you need to do to prevent or lessen this? So what you can do is you can check your cholesterol on the regular basis, and you can get check your blood pressure at regular basis, and you have to take proper medications to keep your cholesterol in check and your blood pressure in check. And suppose if you are a diabetic, then you need to control your diabetes. So all these are very important in preventing any heart attack. Another most important thing which is seen in post-menopausal ladies, the most important cancer which will lead to death in this post-menopausal ladies, breast cancer. So these ladies, they need to get the screening mammography done on an yearly basis, especially if they are more than 40 years of age. So, a regular self-breast examination and screening mammography after 40 years of age is recommended for ladies who are approaching menopause. After 50 years, it is compulsory. Then even brain is affected because of this menopause. So there are chances that she may land up in dementia, Alzheimer's disease. There is more risk of developing all these symptoms. There is a memory loss, and all these symptoms can occur. Then there is a lot of sleep disturbance which is seen during menopause. So how you can improve your sleep? Sleep routine is you should develop good sleep hygiene. Then you should avoid having heavy meals at night, and you should stop alcohol and smoking. And you have to adjust, make your room comfortable and adjust the light and all, and see to it that you have a proper sleep at night. So this menopause, it is not a disease. We should not see it as a disease, but it's a part and parcel of our life. It's a life transition even, and even small things will help a lot in decreasing the symptoms which are related to menopause, like developing healthy food habits, having your exercises regularly, doing yoga, doing meditation daily, keeping your cholesterol, your blood pressure, your diabetes in check. And if you have any symptoms which are very distressing, then you consult your doctor as early as possible and take proper treatment. So all these steps will make your symptoms decrease, and this transition can be made smooth. So thank you. If there are any questions, I would like to take.
Hi, doctor. We have received few questions which we have posted in your chat. If you can answer those.
It is not visible in this chat.
Uh, yeah, I have posted it in the chat on the right hand side.
Hmm?
You can see that.
Yeah. It is coming in comment section. Huh? Those are only the questions. Huh?
Yeah.
I have few questions here which I would like to answer. So it is the question is, if I have other comorbidities like thyroid and diabetes, how do I manage my menopausal symptoms? So if you have thyroid and diabetes, usually after 40 years of age, it is recommended that every yearly thyroid has to be done. And if your thyroid is uncontrolled, then there are more chances of you getting hot flushes and vasomotor symptoms. So you need to consult your doctor, and you need to take proper medications to keep your thyroid under control. And also diabetes, because if your diabetes is not under control, then there are more chances of you having problems related to your heart. If I receive my periods in traces at a gap of 3 months or 6 months, does that mean it is a start of my menopause? So, actually, menopause by definition is that if your age is between 40 to 58 years, and if your menses has stopped for a complete 1 year, 12 months, then we called it menopause. But there is something called perimenopausal transition also, that is before menopause. If you are in this age group, and before this complete stoppage of menses, because the ovarian follicles are very less, hormone production is very less from the ovary, so many ladies will suffer with this problem. It's a common thing which we see, that they may have short cycles or they may have prolonged cycles, that is they may get the cycles in 3 months, 6 months. So yes, if you are in that age group and you're nearing around 45, 46 years, and if your cycles are coming in every 3 to 6 months, and you have consulted your doctor and she has said all your reports are normal, and mostly it is that perimenopausal transition period, and you may have menopause shortly. There are no more questions. So I thank you all for joining this session. Thank you.
Thank you, doctor. It was very informative session. Thank you for
Thank you.
all the information.
Thank you.